They're giving these monkeys THC, no change in D2. Okay, let's talk schizophrenia and cannabis. Something that I'm not a total expert on by any stretch, but I can read the scientific literature, understand it pretty well, and I want to communicate what I'm finding, which is really interesting, to you. So I literally have 6 scientific research papers here and a definition of schizophrenia from the NIH, National Institute of Health, Mental Health, NIMH. They start by saying schizophrenia usually starts between age 16 and 30. The symptoms fall into 3 categories: positive, negative, and cognitive. Positive symptoms are psychotic behaviors generally not seen in healthy people, and symptoms include losing touch with some aspect of reality, such as hallucinations, delusions, thought disorders, and movement disorders, possibly even. Negative symptoms include disruptions to normal emotions, such as flat affect, which is reduced expression of emotions, reduced feelings of pleasure, difficulty beginning, sustaining activities, and reduced speaking. All right? Now you're probably thinking, difficulty beginning activities, maybe that's you. The cognitive symptoms, the poor executive functioning, the ability to understand information, trouble focusing, and then problems with working memory. So again, you're probably thinking, hey, maybe this is me. And that's the problem with a lot of these definitions with these psychiatric disorders. They're kind of vague and cloudy and all over the place. And they kind of describe all of us in certain ways, sometimes. Schizophrenia talks about risk factors. Sometimes runs in families. That's important. If it runs in your family, that you probably know that already. But sometimes exposure to viruses, they say, malnutrition before birth is a risk factor, problems during birth, and then psychosocial factors. Maybe like you saw your house burn down when you were 3 or something weird, psychosocial. Now, so that's the definition, but let's look at the science. Let's look at the biochemistry, because that's what I do. And paper number 1 is from the Schizophrenia Bulletin from 2012, and it's about the biochemistry. It's called NMDA receptor, and schizophrenia, a brief history. Okay, so in my mind, there's really 2 biochemical categories for schizophrenia: NMDA and dopamine. This one talks about NMDA. NMDA, N-methyl D-aspartate receptor antagonists, something that blocks the receptor, replicate the full range and features of schizophrenia in normal subjects. So if you block NMDA, in other words, you decrease that activity, you decrease NMDA, you get schizophrenia. Persistent blockade of NMDA receptors recreates in experimental animals the critical pathological features of schizophrenia. So, in other words, NMDA, if you're blocking that, that's going to cause schizophrenia. That's one way to do it. Paper number 2 in the Journal of PNAS, that's Public National Association of Sciences, I think. Blanking on it for now, but PNAS, really popular journal, really good journal. It's called this paper is called Schizophrenia, More Dopamine, More D2 Receptors. Dopamine 2 receptors, there's 5. There's D1, D2, D3, D4, D5. D2 receptors. They say schizophrenia is a major therapeutic challenge in modern medicine. Of the many contemporary theories of schizophrenia, the most enduring has been the dopamine hypothesis. Increased baseline occupancy of D2 receptors by dopamine in schizophrenia is the main paper they focus on in this review. So in other words, dopamine is the opposite. NMDA, as you have less, you get schizophrenia. Dopamine, as you have more, you get schizophrenia. Increased occupancy of the D2 receptors is seen in schizophrenia. And it's tricky because you literally have to take chunks of brain and test these things. So that's one of the problems here. There's definitely chemicals. It's a chemical thing, but it's not easy to study. They talk about clozapine, some of these schizophrenia drugs, they act on this D2 receptor. And then they say, given the tight correlation between the clinical potency and D2 blocking action of the antipsychotic medications, dopamine overactivity. So that's what they're looking at here. So dopamine, NMDA. Again, opposite. NMDA down, dopamine up, schizophrenia. That's kind of the biochemistry. But what's really interesting, cannabis. We want to talk about cannabis. Okay, a little background on schizophrenia. Now you kind of understand. Cannabis, 2018. This paper, it's called Chronic Delta-9 THC. That's THC. That's the active ingredient in marijuana that makes you high. Chronic THC in rhesus monkeys, this paper is called, effects on cognitive performance and dopamine D2 receptor availability. So they say, this is super interesting. Of course, they always say, marijuana is the most widely abused illicit substance in the United States. That's the first line of the paragraph in the paper. Illicit substance. We've made it illicit. It's a plant. But here's the finding. Compared with controls, D2 receptor availability was not altered during chronic THC treatment in these monkeys. They're giving these monkeys THC, no change in D2. That's interesting. They say not related change. Okay, that's the conclusion. That's the gist. They also say, they do kind of qualify by saying findings for D2 availability in long-term marijuana users have been inconsistent. So they tried to directly examine it using monkeys. The difficulty, again, studying that, if you're a marijuana user and you want to measure your D2 receptor, yeah, you're not going to donate a piece of your brain while you're alive. In monkeys, you can do the study. They've done the study, 2018. D2, not involved. Okay, that cuts that. 2015, I've got a paper here called from the International Journal of Neuropsychopharmacology. That's the kind of thing you want to read when you're deer hunting in your deer stand to stay awake. This paper is called Cannabidiol, CBD, attenuates sensory motor gating disruption and molecular changes induced by chronic antagonism of NMDA receptors in mice. NMDA. So they're looking at NMDA. And they're looking at CBD. Now remember, NMDA, as it goes down, you get schizophrenia. D2, as it goes up, you get schizophrenia. All right, so they say CBD attenuates chronic antagonism of NMDA. It's kind of a complicated title because it's a complicated study. And I'll explain it, try and simplify it. They start by saying clinical data suggests that CBD induces antipsychotic effects. Healthy. Protective, neuroprotective. However, antipsychotic properties of repeated CBD treatment have been poorly investigated. Why? Because we're taking tissues, we're taking chunks of brain. So what do? Repeated treatment with NMDA receptor antagonists. And then they wanted to check if CBD would attenuate those behavioral and molecular modifications induced by chronic administration of these drugs. Okay. So again, it's complicated, right? They're making animals schizophrenic by giving them these crazy NMDA drugs, and then they're putting CBD in to see if that removes the schizophrenia. Okay, and what does it do? I'll just give you the punchline. It says CBD effects were similar to those induced by clozapine treatment. That's a schizophrenia medicine. So in other words, CBD is actually beneficial against having schizophrenia. Even if you're taking these drugs that are causing animals to get schizophrenia-like symptoms, cannabidiol, not THC, cannabidiol is protective. What about THC? I don't know. That's a recent study. I don't think they've done that study, but this is really cool. Get this. 2018 review paper in the Journal of Medicines. It's called The Role of Cannabis Within an Emerging Perspective on Schizophrenia. The Role of Cannabis. So they review evidence on the impact of environmental forces, particularly the effect of autoimmune activity. It's when your immune system is attacking your body in the expression of schizophrenic profiles, and the role of cannabis therapy for regulating immunological function. So if you got an immune system that's disrupted, it can actually lead to schizophrenia. What about cannabis? Yeah. They say the results, a review of the literature shows that phytocannabinoid, that's plant cannabis, phytocannabinoid consumption may be safe and an effective treatment option for schizophrenia as a primary or adjunctive therapy. First line of defense or just add it on top with your drugs. Conclusions, emerging research suggests that cannabis can be used as a treatment for schizophrenia within a broader etiological perspective. Etiological meaning endpoint, cause. So if you kind of have a sense of your cause, If it includes something environmental, autoimmune, neuroinflammatory, then CBD. Let me go a little bit further into this paper. They say several studies have attempted to associate cannabis use with the increase in psychotic symptoms. A lot of studies, actually. It took me a long time to get this video because I had to do a lot of digging. There's a ton of studies that say, look, people that use cannabis get schizophrenia. There's even a paper that says it causes schizophrenia, but it's iffy. I mean, I dug into that. I'm not convinced. And I'll explain why in the next paper. I'll just give you another paper in just 1 minute. It's been proposed that cannabis may influence NMDA receptors, like we talked about. And there's, in fact, a case study from the London Health Sciences Center conducted on one patient that experienced a 20% decrease in D2 activity from cannabis. One person. Major limitation of this study on the and other studies correlating cannabis consumption with schizophrenia is there's no mention of cannabinoid profile. In other words, possibly if the plant is weird, if it's got a ton of THC and no CBD, that's something that's different than a plant that's got a balance between CBD and THC. Because remember, CBD is protective. And if you're at a risk for schizophrenia, honestly, you should look into CBD without the THC. That's a really good option because it seems like there's nothing but benefits there. But even the THC, like I said, I'm not totally convinced. There are several studies, they further say, indicating that CBD could block the temporary symptoms of psychosis exacerbated by THC. So in other words, there's an interplay between those two chemicals in the cannabis plant, in marijuana. So they talk about combined administration, okay? It reduces paranoia. They actually have a study to combined administration of CBD and THC reduce it. In conclusion, they say, sustained states of inflammation in the gut and brain may be caused by genetic, neurologic, autoimmune, endocrine, oncological, pharmacological, nutritional, and other environmental factors, that's what I'm always talking about, including stress, sleep deprivation, heavy metal toxicity, phasic and chronic infections, intestinal dysbiosis, low-grade sensitivities to food, pollutants, etc., chemicals. Okay, so given the, blah, 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 while a variety of triggers likely to contribute to psychosis, a variety of things, we just listed a long list of them, inflammation and CNS immune system activation are always present, almost always present. So those two things, you always have inflammation, you always have central nervous system issues with immunity, autoimmunity. Your immune cells are attacking your CNS, your nerves. CBD in particular may be a safe and effective treatment option in that case. So, super interesting. So that flips the whole paradigm, right? We've all these papers talking about schizophrenia and how it increases your risk. Cannabis increases your risk for schizophrenia. Now they're saying, actually, hey, this is a good therapy option. Let's look at one of those papers. 2017, very recent, Psychological Medicine Journal. This is called Association Between Alcohol, Cannabis, and Other Illicit Substances Substance Abuse, and Risk of Developing Schizophrenia, a nationwide population-based register study. So, final paper here. I just want to give you an example of what most of the research on schizophrenia and cannabis is. They start by saying several studies have examined whether use of substances can cause schizophrenia. That's a big word, cause. However, due to methodological limitations, there's still uncertainties. In other words, it's messy, this idea of cause. I'll give you an example. This paper, they looked at the nationwide Danish registers of 3 million individuals. 200,000 plus were diagnosed with substance abuse. 21,000 were diagnosed with schizophrenia. So what they're doing is they're aligning people that abuse substances and schizophrenia. That's what they're doing, and that's what most of the studies are doing. So you can't say that, schizophrenia is caused by cannabis. They can just kind of link up the cannabis use with schizophrenia, and they do some fancy math, and then they say, those are connected. So their conclusion basically is a diagnosis of substance abuse increases overall risk of developing schizophrenia. This is 2017. This is kind of a culmination of a lot of research. This is what most people are claiming these days. Cannabis, alcohol, hallucinogens, sedatives, and other substances increase the risk significantly. But do they, though? Or maybe you were going to get schizophrenia anyways. Maybe that's, maybe you're getting schizophrenia and then you start abusing substances. It doesn't mean that if you abuse substances, you're going to get schizophrenia. I don't think that's connected. It's not a very logical conclusion what they're doing here and what most of these studies are doing. Our results illustrate robust associations between almost any type of substance abuse and the increased risk of developing schizophrenia later in life. And that's important because, again, we talked about D2, we talked about NMDA, we talked about the biochemistry here. And that's why it's so important to look at the biochemistry and kind of understand the biochemistry, because if you don't, then you're just shooting in the dark and you're just guessing based on how people feel and questionnaires, and those are really iffy studies, and man, there's a lot of them out there. Thanks for hanging with me this whole time. Let's do another episode coming up on, well, let's do 2 episodes. Well, let's do one on genetics and paranoia and psychosis, and then we'll do one on epigenetics. I want to talk about epigenetics and how you can actually pass on health impacts with cannabis.